Erica. I am 52 years old and I am in perimenopause, and I have been going through all the things. Okay, so I hot flashes, night sweats. I've tried, a couple of over-the-counter methods that I'm not getting a lot of relief from. It's temporary relief, but I spoke with my physician about it, and so a few months back she talked with me about trying some options, that there was some help for me. But sometimes you hear about hormone replacement therapy, it's very scary because you think about all the side effects that could come with it. So I declined it then. That was a few months back that I said, no, let me just wait. I want to research it a little bit. I still never really researched into hormone replacement therapy. And so I was using stuff like, I found on TikTok and things like that. But I am, it's like I got to find some help, you guys. I got to find some help. My anxiety is through the roof. Okay, like my anxiety, like I'm usually okay. Like I'm a claustrophobic type of person, but my last flight was the first time that I actually found myself panicking about the doors being closed. I can definitely tell that my claustrophobia has gotten worse. Like even when I go to the bathroom and stuff, I'm always nervous about the door not opening, and that's really weird for me. Like I used to be able to control my claustrophobia, so I know it's the anxiety that's got me through the roof. That's got me thinking that I'm going to get locked in, all the things. And so even on the plane, that scared me, that I freaked out a little bit, because internally I was about to get up and run and tell them to let me off the plane. And I've never done that. I've flown 1,000 times, so I know I got to get some help. The night sweats, the hot flashes, all the things, okay? It is just, I'm not, and don't even talk about sleep. Insomnia is out of control. So February, I turned 52, February just passed, and so I haven't had a period since then. And I'm thinking it may have been January since I've had a period, but it kind of kicked in pretty quickly. Like as soon as I hit 52, I hadn't had a period since then. And so, I've been just kind of following some people's journeys, and so I spoke with my physician about, what my options was, and she mentioned some things about like I could put some pellets vaginally in. I'm not really sure exactly, but she did mention that, and then she was talking about a procedure that's like a surgical procedure that I guess the pellets is a surgical procedure. I might be a little confused. If you guys can clarify in the comments, I'd be fine. But it was something that I would have to go on anesthesia, and they would do something, and that was a way that I wouldn't have to take medications for now. Anyway, I did decline to go through any of those things and thinking I could just take care of it myself. But I hadn't had any levels drawn, so I wasn't sure exactly where I was level-wise as far as where I'm at on, blood work. So she did draw blood work at that last appointment. That was a few months back, and so I didn't go back until last week to see her. And then she went over my numbers with me, and that's when I found. So they did go ahead and draw blood, and when I went back this last week, I was able to get some results, and I'm just hearing the numbers. Like, I'm not really familiar with the normal numbers, but where I was very low in comparison to where I should be, like pretty low, like 0.00 in some numbers, and even my thyroid was even low. I'm not sure if that has anything to do with my me being in perimenopause, but my thyroid levels was low, so I decided to go ahead and just move forward. I got to try something, so I had her to go ahead and place the order she wanted to go ahead and try me on progesterone, 200 milligrams once at night, and she said it will make you sleepy, so she suggested that make sure I take it right before bed. And then she ordered the thyroid, which is the Armor thyroid one. She said that was the one with the least like it was the most natural form of it, and so I was nervous about taking that. I'm a whole nurse and I hate taking meds, right? So even when she ordered it, I still sat it in the room for a couple of days because I'm like nervous about taking medications and side effects and all the things. So I ended up just this weekend going through a lot of people's posts and reading about hormone replacement therapy and the benefits, and how people say it immediately started changing their lives. And now that I was reading over all that information, I'm kind of mad at myself because I've been going through this so long that I probably didn't have to be going through it as long as I have been going through it. So I took the first dose of the progesterone. Tonight will be the third night. So, and then I took the thyroid also, today was the third dose of the thyroid, because I've been sitting there holding it, scared to take it, because I'm just not sure what's going to happen. But anyway, the progesterone, day one, I took it. They say you fall asleep pretty quickly. I did find myself getting sleep because I'm telling you guys, I'm up and down all night. So immediately, I still felt the hot. So I did feel the hot flash. I would assume that I wouldn't have results that quickly, but I felt like I actually was a little inch less. And that is going to be in my mind, right? And then day 2, and then last night, I slept a little longer because I literally been getting up like 3 o'clock in the morning, 4 o'clock in the morning, and I've been sleeping the last couple of days at 5:30, so that's a plus for me, okay? So today will be day 3 of that, and overall, I'm feeling pretty good. Like, the hot flashes are still there, but I can say they don't feel as frequent as often. So, I'm going to keep you guys posted. I just want to come in and share with you guys about my HRT journey. I'm excited to see, I've seen people who say that the hot flashes went away with the treatment. Like, they really was able to live again. And sometimes when it hits me, it's like I'm almost itching inside. Like, it's like I'm about to, it's just so, it's miserable. It's a miserable feeling, you guys. And I don't wish this on nobody and anybody who's headed in this direction. Like, some people say some people do say that, that they feel like immediate relief, like it was just kind of quickly. So I don't know if anybody could add in the comments, below. I'm going to share my journey with you. Again, this is day 3 of my progesterone journey. And just, I'm hopeful that, I will see some, good results with this. So far, I feel overall better. I've been trying to write down the times. Like, I'm trying to pay attention to the times that I have the hot flashes, so I can kind of see how less. Like last night, I remember around 2:30, having one, and I remember it being a few hours later that I felt another one. So, I'm just hopeful, you guys. I just want to come in and share this journey with you, and I'm gonna keep you guys posted on my journey and how it goes. And let's see. I hope I can get over this and the anxiety part of it and all the things. So, y'all, I'm gonna stay. I'm gonna keep following your journey, and if you can add, give me any advice, I appreciate it. Again, I'm on the progesterone 200 milligrams. It is a capsule form. Let me go grab it for you real quick. Hold on. All right, y'all. These are the capsules. So they did me a 90-day supply with a 1 refill. So it's just like a gel cap. So it's not hard to take down or anything. Progesterone. 200 milligram capsule, AUR is the name of it. So I'll keep you posted, you guys. Talk to y'all soon.